Dr. Stephen Kosterman, Kosterman Chiropractic Center, and in this video series, we're continuing to talk about shoulder problems. In particular, in this video, why would we use an x-ray to evaluate your shoulder if you have shoulder pain or impingement or instability or frozen shoulder? Why would we utilize an x-ray? Well, the big underlying thing that we want to address is arthritis or degeneration in your shoulder. So if you have arthritis or degeneration in your shoulder, that can certainly contribute to these symptoms that you're having in your shoulder. So we want to make sure we know exactly what we're dealing with, right? So an x-ray is a really quick way to utilize a very quick image to see what's going on inside there, right? So what are we looking for? Is there enough room for the humerus and the glenohumeral joint? How are all the structures? Is there any bone spurring, right? Is there any room for those joints and bones to move around? So an x-ray is a really quick way to assess that. It also tells us the limitations of what we can do for you. If there's limitations, do we need to progress and order an MRI if the x-ray and the exam doesn't show us exactly what we need to? It's a really way to rule in or rule out, or diagnose what's going on with your shoulder. And in our office, we have digital x-rays. It takes, 2 seconds to get that image. So sometimes we need to order more images, or an MRI would be kind of the gold standard if the x-ray doesn't show us what we need to, if we need to, or co-manage or send you to another provider if you do have significant degeneration or wear in that shoulder joint from an old injury. So we have lots of providers that we like to refer to, whether it's a physiatrist who manages pain or does injections, or orthopedist. We have a great orthopedist we refer to all the time. And we have a lot of physical therapists that we refer to as well. But from a chiropractic standpoint, we do a tremendous amount of work on a lot of shoulders day to day, because a lot of it's structural, but we always want to get an x-ray to rule out any underlying degeneration or wear or big pathology underneath. So it's a quick way to do that with, keeping in mind, getting you the fastest result, the quickest way and the best result that we can get you in our office. So thanks for listening. Thanks so much. And we'll see you on the next video.